Just curious, what are some of the health issues that you're seeing occur in children who are fed a diet that's heavy in dairy, wheat, with gluten and sugar? What are some of the biggest issues that are showing up right now?
Eczema,
Okay.
constipation, asthma, recurrent ear infections, anxiety, belly pain. Did I say constipation? Yeah, constipation. Headaches. Those would be the top ones that I see related to this.
What about for parents who are curious about kind of what's going on with their kids' bodies? If they've got a normal weighted child, but the child starts to get a protruding belly, kind of like a round basketball shape, what are some of the things that may be going on? And I recognize this is a general comment. It's not a diagnosis.
Totally. One of the things that my first question is going to be their bowel movements. So speaking of detox, another thing that has to happen every single day is children have to poop every day. The colon is one of the major detox organs. If you're not pooping every day, your child is not pooping every day, they're not detoxing, and their belly is going to get really poofy. And when I say pooping, it's not a pebble. We're talking a long brown snake that is easy to pass. Sorry, my friends, but everyone is like, oh, we don't want to talk about it. I'm like, oh, it's one of the most important bodily functions, right?
Let's put a long brown snake as a pop-up here. Thank you.
It is. So on the Bristol stool chart is a type 4, and that shows us that the body is working properly. So number one, what is the stool pattern? A lot of the kids with that belly issue you're talking about are constipated. They're not pooping. They're not eliminating. They're not detoxing. Then we have the kids that just have poor digestion. Let's say that they're pooping, but their belly is still big. So in the morning, they wake up with a flat belly. By after breakfast, after lunch, the belly gets bigger, then flat, then big. That speaks to abnormal digestion. In our body, we have digestive enzymes starting with our saliva, in our stomach, past the liver and the pancreas, in the small intestine. And sometimes due to different lifestyle factors, genetics, diet, stress, lack of movement, etc., we have a decrease in our digestive enzymes, which then prevent the good food coming in from being absorbed into the body. So when the food is not absorbed, it sits in the colon, the bacteria tries to break it down, which causes fermentation, which causes a whole bunch of gas bubbles. And now the child's belly is giant.